this short video, I'm going to try to answer a question that many of our patients ask, and that is, why are some compression stockings, and I'm talking about knee highs for the purpose of this video, but why are some compression stockings $20 and why are some $100 or $300? And from my experience, my name is Robert. I'm a lymphedema therapist with 10 years experience in the field. I've seen over 1,000 patients that has to wear compression stockings. And so what I've learned from experience, there was a while when we tried to save money for our patients, and our advice would be to first try the $20 stockings before you go into the $100 stockings. But we had too many failures with that and too much suffering, and had to treat the swelling again to get back into the right stockings. So to get to the question, what's the difference between a $20 compression stocking and a $100 knee-high compression stocking? Well, there are several differences. We kind of have a saying that if you pay more up front, it only hurts once. If you pay less, it might hurt every time you wear them. A big difference that causes the price to be higher is if you buy a $20 pair and you look at the sizing chart, they may have 3 different sizes, maybe 4. They'll be small, medium, large. If we think of how many different sizes and shapes of people there are, we know that with only 3 sizing options, the chances of one of those 3 fitting your particular size and shape are very slim. So it's a little bit like buying a lottery ticket. If you happen to be one of the lucky 3, that fits into that. There is no such thing as one size fits all when it comes to compression, because the size has to be precise. Or it might say 20 to 30 on the box, but 20 to 30 millimeter mercury pressure, but you might be getting 50 millimeter mercury at one part of your foot and 10 at another if the shape isn't the same as your leg. So sizing is the big difference to me between $100 and $20 stockings. We use the Medi, Juzo, Jobst, and Sigvaris, all the big stocking companies. Medi, for example, they have 7 different sizes. Within each size, there are 2 different calf widths. There are 2 different lengths. Juzo carries 3 different lengths. There are some that have a bigger foot portion. So you end up with between 20 and 30 different options for the same stocking. So now you have a much better chance of pinpointing your size and your shape. Of course, for a company to carry that many different options, the manufacturing, the stocking, the shipping, everything is going to be costing a lot more, and that's part of what you pay for. Of course, the other part, as with anything, usually if you pay more, there's better quality, so the thread that they're using, the elasticity, will hold much longer. You buy a pair of $20 stockings, what we found is they might, if you happen to be lucky enough that they fit you, they may still only work and actually give compression for a month or 2. And we've found that with the high quality stockings, they can work up to 6 months and still give proper compression so that your legs are not swelling. Then if we step up to the like $200 range stockings and $350, $400 for a pair, now we're talking about custom made and a thicker fabric called flat knit. And I won't get into all the details about circular knit, flat knit. It's a whole science about that. I just recommend that you give us a call and we can help you sort all of that out. But a custom made garment, even if you have 25 different options on an over-the-counter at that range around $100, it's still an over-the-counter, which means that they were made first and we're trying to size it to your leg. To go one more step up, you can actually make a stocking to fit your exact shape. And what you get for a pair, it's about $400 actually, close to knee highs. But what you get for that is an exact fit, and you can return them and remake them as many times as you want. So with our patients, if they pay that much for their stockings, we remake them as many times as we need to until they fit perfect. So they will be truly custom made to your size and shape. If, of course, if money wasn't an issue, we would do that with everybody. That's the optimal way to go. But we understand that we always try to keep the most affordable stockings first. I hope that was helpful. It is a common question that we often get. As always, give us a call here. Our mission is to try to help everybody across the country to be able to actually wear their compression stockings by teaching you how to put them on, making sure that they fit right. I hope to hear from you.